Hello, everyone. Today we're going to start out by talking about cognitive behavioral therapy, also known as CBT. So what exactly is cognitive behavioral therapy? Cognitive behavioral therapy, or CBT, is a psychotherapy that may help a client change unhappy or unhealthy ways of thinking, feeling, and behaving. What are the approaches to cognitive behavioral therapy? This is according to the textbook titled Theory and Practice of Counseling and Psychotherapy, written by Gerald Corey. So first of all, you want to have a collaborative relationship between the client and therapist. Second, the premise that psychological distress is often maintained by cognitive processes. Third, it's a focus on changing cognitions to produce desired changes in affect and behavior. Third, a present-centered, time-limited focus. Next, it's an active and directive stance by the therapist, and educational treatment focusing on specific and structured target problems. So when you and a client enter cognitive behavioral therapy, you will go through some stages. So I just want to give a brief description about each of those stages right now. First stage is the assessment. You will begin with an in-depth assessment with your client. This is where you build a rapport with the client and build trust. As a therapist, you want to look at the client's mental health and thought patterns and behaviors. The second stage of CBT is formulation. This is where, as you, being the therapist, you work together with the client in this stage to figure out the issues at hand and what is contributing to their struggles. The next stage of CBT is active intervention. You will develop strategies and interventions with the client that align with their needs. This may include things like exposing the client to fears and practicing coping skills. The fourth stage is maintenance and relapse prevention. The client will enter the maintenance stage where they will continue to practice skills previously learned. If successful, the client will learn how to identify triggers and gain long-term success. When exactly is cognitive behavioral therapy useful? Well, cognitive behavioral therapy sometimes uses exposure therapy, and that can be useful for disorders like anxiety and OCD, which is overactive compulsive disorder. In exposure therapy, a client is exposed to items or situations that are known to induce fear. And you can start off with small things and slowly work the client up to more difficult situations until the fear is conquered. Cognitive behavioral therapy can also be used in treatment for depression by changing thought patterns and therefore positively impacting the client's mood and behaviors. But what I would like to talk about is a certain mental disorder called substance use disorder. And in a minute, we'll kind of talk about how you can use cognitive behavioral therapy in treating substance use disorder. So what is substance use disorder? It is defined as the inability to control the use of substances such as legal or illegal drugs, alcohol, and medication. Diagnosing substance use disorder. So these are the symptoms that you will look at when diagnosing a client with substance use disorder. First, they're using more of a substance than intended for longer than they are meant to. Second, they're unable to cut down or stop using the substance. Having intense urges or cravings to use the substance. Needing more of the substance to reach the desired effect. Developing withdrawal symptoms when not using the substance. Neglecting important responsibilities in order to use the substance. They are continuing to use even when it's causing problems in their relationship, whether it be a romantic problem, relationship or family relationships. No matter the problem, they'll still keep using. They're giving up activities that they once enjoyed or important to them in order to use their substance of choice. They put themselves in risky situations to use a substance, and also continuing to use a substance despite the effect it has on their mental and physical health. So how can we apply cognitive behavioral therapy to substance use disorder? Cognitive behavioral therapy can help the patient identify the thoughts and feelings that may lead to substance use. For example, if you have a client in treatment and they have a thought that, you know what, I've been clean for 30 days, I might as well go out and use to celebrate. In cognitive behavioral therapy, you learn to teach them how to replace those with thoughts like, I've been clean for 30 days and I deserve to live a sober life every single day. CBT can also teach a client how to distract themselves from cravings with activities like journaling and attending groups or meetings with people who are going through something similar as them. CBT can also help a client identify the pros and cons of using and the pros and cons of sobriety. And oftentimes the pros and cons, or the pros of sobriety, often outweigh the pros of using. You can show the client how to practice behaviors and attitudes of self-respect and counteracting beliefs that undermine themselves. A lot of people in active addiction have really low self-esteem and they think really negatively about themselves. Cognitive behavioral therapy can help them change that way of thinking. Cognitive behavioral therapy also helps ensure that the client identifies people in situations who may trigger them to relapse and surrounding themselves with positive support. CBT can also teach a client how to support their sobriety by having a daily routine, avoiding anger, and having meaningful hobbies that promote serenity, for example, meditation and yoga. So yeah, that's kind of a brief overview of cognitive behavioral therapy, how it can be used to treat substance use disorder, and what to look for when diagnosing substance use disorder. This is just a fun fact that I want to end this slideshow with. I am a recovering addict. These are photos of me when I was in active addiction. I struggled with substance abuse for many years, and I finally found sobriety on September 13th, 2017. While in treatment, I met a therapist who absolutely changed my life. She taught me so much about recovery, how to avoid relapse, how to change my thought process and establish boundaries. And she is the reason that I want to go into this field of work. She changed my life, and I want to be that person to somebody else who is struggling. All right, everyone, thank you so much, and I hope you all have a good day.